And welcome back into the Closers here alongside Jay Sparks. I'm George Young. Hope your day is going well. And thanks to, full guest list today here on our Thursday. Dave Matter, St. Louis Post-Dispatch, Dan Israel, Chiefs Fox Football Radio Network, Jeff Pecoro talking about the Kentucky Wildcats. And now we're going to talk medical things, issues, whether it's soft tissue injuries, knee injuries, that type of thing. And also a great presentation that happened down in Perth a little while ago. Dr. Richard Maw, Missouri Orthopedic Institute, joining us now here on the program. But don't forget about their clinic on Saturday morning. That is a free clinic, free walk-in clinic from 9 to 10 a.m. over at the Missouri Orthopedic Institute. It is a fully staffed clinic, x-ray machine, and they also give you referrals after the initial diagnosis. So if your child, after Friday night activities, is not handling things very well when they try to get up on Saturday morning, get them on over there. Again, it's a free clinic from 9 to 10, Missouri Orthopedic Institute. Dr. Maw, thanks for taking the time today. I really appreciate it.
Yeah, thank you guys for inviting me back again today.
Oh, yeah, we never turn something like that down. I understand that in your line of work, sometimes the surgery has to be scheduled whenever the surgery can be scheduled. So I appreciate you taking the time. Let's start with this presentation that you did down in Perth, U.S. Women's Amateur Rugby Sevens. First off, how did you get involved in this conference?
Yeah, this is a continuation of a research that I started actually when I was a fellow in New York City. Mm-hmm. So I've been working with a for-profit group out of New York and have been studying amateur rugby injuries over the last 8 years or so. So we can continue that on a national level.
Okay, now this presentation was about contact injuries, but also playing surfaces. And I grabbed your tweet from it, and it was, while contact with other players cause injuries, contact with the playing surface lead to a third of the injuries in the female population. How did you guys come up with that? I mean, because you're talking about pretty intensive injury surveillance.
Yes. So we've been studying how these match injuries happen in our amateur athletes for rugby. Mm-hmm. And what we found out that, as you expect with a contact sport, a lot of the injuries happen when a player makes contact with another player. But on the U.S. side of things, especially for our women players who may not be used to playing contact sports because we really don't have another mainstream contact sports, the ability to fall safely is also important. So about a third of our injuries in our women population actually occurred with contribution from the ground. So how they hit the ground also mattered. And the injuries that they sustain from hitting the ground sometimes is as severe as having another player hit them.
Wow. Okay. And did it make a difference between a playing surface, whether it was a field turf or natural surface?
So we saw it more so on artificial surfaces in terms of the incidence, meaning how frequently it happened in this specific population in terms of the women.
This has been a thing that I know the U.S. women's national team has argued against, because the men will play on natural grass surfaces while the women more often than not find themselves on a field turf surface. Does this lead more credence to their argument that, listen, we get more injuries because we're on field turf as opposed to natural surface? I
think this type of evidence obviously raises that question. Mm-hmm. It's complicated because I think field turf, as a specialist would tell you, there's so many different kind of field turfs now. Some of them are pretty sophisticated and are made in such a way to try to reduce those type of injuries. And so I think it does at least raise that question. But I think answering that question in terms of is it the same for all different kind of field turf, that's a little bit harder to tease out because that question is a little bit more complicated.
If you had a chance to work with someone who made artificial surfaces, could doctors improve an artificial surface? Could you make an artificial surface that gets closer and closer to approximating natural grass as far as causing injuries?
Well, I think this type of research helps, because if you don't understand the rates of injuries that are happening on these surfaces, so if you don't keep track of them, then how do you really know if one particular type is worse than the other? And so that's part of the message that we have with this type of research, is that it's important for us to look at injuries and keep track of those so that we can make some of these medical decisions.
Again, this conference was down in Perth a little bit ago. The title of the piece, Risk Factors of Contact Injuries Among U.S. Women Rugby Sevens. This is an amateur, not an amateur piece, but it's about the amateur athletes. Has that been published as of yet, or is this still the a PowerPoint presentation?
Well, we're actively publishing. Our group have actually published some of this research already in terms of different aspects of it. But this research will be published, and we're part of doing research is sharing it with the scientific community, and I certainly appreciate the chance here to just share it with the general public. But it's about trying to improve the welfare of these kids that we are taking care of, so that they can hopefully play sports and have the benefit of sports, but not the downsides of sports.
I know the most aggravating part about traveling to Perth would probably be all the time zone changes. But what was the one thing that outside of the conference that stood out to you, the most fun you had?
I think the wildlife out in Australia is just phenomenal. I think it's nothing like here in the United States, and I really enjoy that a lot over there.
Dr. Richard Maum, University of Missouri with us, Missouri Orthopedic Institute. Don't forget about their free clinic on Saturday morning from 9 to 10 a.m. For all of the athletes, especially in the in high school and junior high school, especially after Friday night football. And now you got softball going on. You've got volleyball going on as well. So check that out. It's a free clinic, walk-in clinic from 9 to 10 a.m., Missouri Orthopedic Institute. I know we've discussed in the past about knee injuries. We've talked about soft tissue injuries. For you as a physician, the most vexing of the soft tissue injuries, is it as a groin injury? Is it a hamstring? What's the one that just you're like, oh, I hate that one?
Yeah, I'm going to tell you the ones that you listed there are all pretty bad because I think what we realize is that for an athlete that's in season and they have one of these soft tissue muscle injuries, a lot of times they're probably going back when they're not fully healed. And so this is something they potentially have to deal with during the course of the season. So I don't know if one is necessarily better than the other. I think they're all pretty challenging in general. And they all limit athletes in very substantial ways.
And we see these high performance athletes, and even in the NFL, I've heard some of the former athletes say, "Listen, on a hamstring issue, you've got to wait for that thing to be completely, fully healed before you get back out there again. Otherwise, it's going to affect you. It'll affect you right on into the next season." How hard is that as a physician to relate that to not just the athlete, but to the coach and to the parent that this is a long term thing, and you may end up not being back?
Yeah, I think it's very challenging, and each person that you just named there has a different interest in terms of what they're hoping would happen as it relates to that injury. And I think from a coaching standpoint, they obviously want the athlete to be available, if their health permits. And I think one of the good studies that I saw when I was out in Australia actually addresses this topic specifically, is that these injuries, by the time we get them back at 6 weeks, these kids are still at similar, at increased risk of redeveloping that injury. And that to get them out of that window where the risk of having a recurrent hamstring injury or recurrent groin injury to happen, that may be several months later. So if you keep them healthy for several months later, then the risk goes down. And obviously in the course of a sports season, several months is already the entire season. And so I think this is why it's so challenging for everybody that's involved when it comes to these type of injuries, especially during the in-season.
Can anything be done? Because the goal for the athlete is to get back as fast as possible. What are some of the treatment aspects or modalities that can be done to try to speed things up, whether it's muscle stimulation or e-stim or something like that? Can that help?
Yeah, I think all of those help because initially you just need the athlete to relax and be able to move that joint. And so all of those soft tissue modalities that you just help that therapist is going to employ help get the athlete at least mobile and started on that healing process. And then as they improve, you want to try to match their increased activity as they feel better. And so, but all those modalities that you mentioned there, those are all absolutely important to at least get them out of that initial injury pain and into something that's more functional so that we can progress them on a rehabilitation to closer to what, at least return them onto the field.
Is there a way, I know George just said, especially with hamstrings, things like that, how you kind of have to wait for a 95, 96% clear before you want to go back out there and test it again. For some of the other ones, is there a way for athletes to continue conditioning, continue working on things as those injuries heal so that they can they feel like they're staying in shape enough so that when that time comes, they're ready to go?
Absolutely. I think a lot of it depends on the type of athlete in terms of the level of competition competition, the resources they have with them. But for example, for Mizzou athletes, there are ways to get them in the water. For example, for lower extremity injuries, where they can start doing some things where they could take some of the gravity away from them, so they can at least start doing some of the more challenging things physically without putting a lot of impact on the leg that they just got injured. So for kids that have that kind of resources, we can employ them to start getting them back into shape without putting a lot of stress on that lower extremity. So for that type of competition level, we do have technology that can help them get back a little sooner.
Dr. Richard Ma, Missouri Orthopedic Institute, with us here on The Closers. Again, it's a free clinic on Saturday morning from 9 to 10 a.m. Walk in. Referrals are available, but it's a great place. It's a great first step if something is not quite right, even if you think everything else seems right, but there's just something that you're twigging to, get them on over there for that evaluation. Knees are something that we have talked about with you in the past. And we saw, in the NFL over the course of the weekend, we lost a couple of players for the season with ACL tears or ACL-MCL combination tears. As a physician, when the patient presents ACL-MCL tear, what's the process to getting them back to being able to go to rehab and then get back on the field?
Well, I think for those type of injuries, I routinely do rehabilitation before surgery, to at least get some motion and some muscle recovery with that combination of injury. And I do think MRIs are important in those type of injuries because you're trying to just delineate. You already know that they have an ACL tear. You're just trying to delineate what that MCL tear looks like in the location so that you can make a determination. Is that something that's going to heal on its own? Or is that something that I'm going to have to do surgery with at the same time with his ACL surgery? So I think the imaging is particularly important, especially understanding the type of MCL tear that may be, and those factor in terms of how to manage that athlete, especially with surgery.
I know Rex's favorite story is telling the story of Henry Josie and the repair and all of the rehab that he went through. But generally, is it the MCL that's repaired first just to provide the stability, and then you work on the ACL later? Yeah,
I think for me. The fine nuances of the surgery, I think usually I get the ACL kind of prepared, and then I work on the MCL, and then you have to tighten these things. So usually I tighten the MCL.
Like a turnbuckle and just kind of...
something like that. That's not too far off, actually, honestly. But I usually then tighten down my MCL, and then I tighten down the ACL. So there's a sequence.
Okay.
End of the day, you want that knee to have full range, and then it has to be stable in the operating room for you to feel good about that surgery.
Like lug nuts. You don't want to go now. You don't want to go around the circle. You got to go around a star. You got to be careful with that.
Okay, from turnbuckles to lug nuts to spark plugs. We'll deal with the entire thing on your automobile coming up here in just probably a little bit, or probably not. Diet. I mean, you see these high-performance athletes with a lot of different diets, whether it's a paleo diet or it's drinks and smoothies and all the rest of that kind of thing. Have you seen is there research out there that will either support a particular type of diet or that says, man, this diet really leads to problems down the road for a lot of musculoskeletal injuries? Well, I think my gut sense is that the proponents of each of those individual diets probably can find research that will support what they do. I think just my general principle is that an athlete needs to have a very balanced diet because they're burning through a lot of calories. And usually a high-performance athlete will keep track of what the energy expenditure is and then match their diet to make sure that they at least refuel and replenish so that their bodies don't break down. When you have that seesaw where you're burning more energy than you replenish in your body with, then you're prone to probably injuries. So whichever diet you choose to do, I do think it needs to at least give you what your body needs. But I suspect, research-wise, you could probably find different type of research that support different types of diet based on whichever individual wants to talk about that. But overall, I think a good balanced diet that matches the energy expenditure of that particular athlete is important because I think they need that energy in order to let the body heal.
for the next match or during the training.
Dr. Richard Mull, Missouri Orthopedic Institute. Again, the clinic is Saturday morning from 9 to 10 a.m. It is a walk-in clinic, and full referrals are available to you. Please take advantage of that. That's a great first stop for you, especially if you're dealing with what you might think would be a concussion or a soft tissue injury. Get that taken care of, because the sooner you get it taken care of, the sooner your athlete can get back. What's the next project that you're working on? Because it seems like you're always working on something.
I have a lot of projects that's ongoing.
Okay.
The community injury surveillance with sports, that's a project that's going to continue to go. Like I said, I've been doing that for 8 years. I also do a lot of research on ACL injuries and ACL surgery and how people heal. So those are my two main research projects and research interests just in general. But I'm an academic orthopedic surgeon, so I think we try not to only teach the next generation of surgeons, but also help hopefully develop knowledge that will help us better treat people going forward. So I think that's one of the great things we're going to do at University of Missouri and Missouri Orthopedic Institute.
All right, Doctor, thank you much for the time. I really do appreciate it.
All right, thank you guys very much for having me here again.
Oh, you're not a problem at all. It's always an interesting conversation. Dr. Richard Mull.
The Closers on News Talk 1240 KLIK and News Talk 1400 KFRU.